Hi, I'm Dr. Suma Krishnan and I work as a medical retina specialist and a comprehensive ophthalmologist at Zamindar Microsurgical Eye Center, Bangalore. Floaters. Have you ever noticed tiny spots, squiggly lines, or cobweb-like shapes drifting across your vision? These are called floaters. So the next time you see clumps or strands floating in front of your eyes and you go to see your eye doctor, you can tell him or her that you are seeing floaters. And this is not really an uncommon presenting complaint in an eye clinic. Now, why do we see floaters in the eye? The inside of our eye is filled with a clear jelly-like substance called the vitreous. As we grow older, this jelly becomes a little watery and can form tiny clumps or strands. Now think of it like this. Imagine you have a clear jelly with a few specks of dust inside. When you shine a light through it, the dust casts little shadows. In the same way, the clumps in the jelly of the eye cast shadows on the retina, the light-sensitive screen at the back of your eye. And these shadows are what we see as floaters. They may look like dots, strands, or little cobwebs, and they usually move as your eye moves. When and why do they appear? Most floaters are harmless and simply a part of the aging process. As we age, the vitreous gel becomes more watery and can clump together. These clumps cast tiny shadows on the retina, which you see as floaters. The next common cause for floaters is a posterior vitreous detachment or a PVD. This is a normal physiological process where the vitreous separates from the retina with age. This is commonly seen after the age of 50 years. While PVD itself is usually harmless, it can sometimes pull too hard on the retina, leading to retinal tears. If not identified on time, these tears can even lead to retinal detachments, resulting in sudden loss of vision. Bleeding in the eye due to conditions like diabetes or diabetic retinopathy can cause floaters. When there is bleeding in a patient with diabetes, it invariably means that the diabetic eye disease is quite advanced and needs to be treated urgently. Another cause for floaters is a condition called uveitis. The eyeball has 3 layers and the middle layer is called the uvea. And an inflammation of the middle layer of the eye can also cause floaters, especially when it affects the posterior or the back part of the uveal tract. Uveitis is not just an eye problem. It may signal an underlying systemic disease. Proper evaluation often requires blood tests, imaging, or referral to a rheumatologist, physician, or infectious disease specialist. Early diagnosis and treatment of systemic disease can prevent recurrences and protect vision. Injury or trauma to the eye can also present with floaters. If you see suddenly many new floaters, flashes of light, or a curtain-like shadow over your vision, it's important to see an eye doctor right away. These can be the signs of a retinal tear or a retinal detachment. So remember, a few floaters are normal, sudden changes are not. Protect your eye by getting regular eye checkups done.